Hey everyone, or I guess I could say buongiorno everyone, just because I'm actually in Italy for class this week. I'm very blessed to be at a close friend's wedding. So if it looks really dark, that's because I'm filming this at about 3 p.m. my current or Colorado time where I usually at, but that is 11 p.m. in Italy. So coming a long way for this discussion. But anyways, for this week's discussion, I want to explore how exercise may diminish cancer risk and why I believe physical activity should be viewed as an investment in our future health rather than simply a tool for weight management. Now, when most people think about exercise, they often associate it with losing weight or improving physical appearance. While those are certainly important benefits, research has consistently shown that regular physical activity also plays a significant role in reducing the risk of several chronic diseases, including certain types of cancer. According to organizations such as the American College of Sports Medicine, the American Cancer Society, and the World Health Organization, adults who meet recommended physical activity guidelines have a lower risk of developing several cancers, particularly breast and colorectal cancer. Now, breast and colorectal cancer are two of the most well-studied examples. Numerous epidemiological studies have found that individuals who engage in regular, moderate to vigorous physical activity have a lower risk of developing these cancers compared to those who are inactive. In addition, research suggests that physically active individuals diagnosed with these cancers often experience better treatment outcomes, improved quality of life, and lower rates of cancer recurrence. Now, one reason exercise appears to provide these benefits is that it influences multiple biological systems at the same time. First, regular physical activity improves insulin sensitivity and helps regulate blood glucose levels. Now, chronically elevated insulin and insulin-like growth factors have been associated with increased cell growth and may contribute to cancer development. Now, exercise also helps regulate hormones such as estrogen, which is particularly important because elevated estrogen exposure has been linked to an increased risk of certain breast cancers. Another important mechanism is the reduction of chronic inflammation. Persistent low-grade inflammation is recognized as a contributing factor in many chronic diseases, including cancer. Regular physical activity decreases inflammatory markers while improving immune system function. Exercise also enhances immune surveillance by improving the activity of immune cells that help identify and eliminate abnormal cells before they develop into more serious problems. Although body weight often receives the most attention, I don't think that weight loss is only or even the primary reason exercise lowers cancer risk. Exercise improves body composition, cardiovascular fitness, metabolic health, muscle function, and overall physiological resilience. Together, these adaptations create an internal environment that is generally less favorable for cancer development. One aspect of this topic that resonates with me personally is working with some clients who have already faced cancer. I currently train a client who is a throat cancer survivor, and he's now luckily in full remission. He's one of the hardest working people in the gym, and it serves as a reminder that exercise isn't only about preventing disease, it can also play an important role in helping people regain strength, confidence, and quality of life after treatment. Now, while every survivor situation is different and exercise programs should always be individualized, experiences like his reinforce how powerful physical activity can be throughout the entire health journey. That leads me to what I believe is one of the most important takeaways from this week's discussion. I see exercise as an investment in future health. As a personal trainer, many clients initially come to me because they want to lose weight. However, over time, some begin to realize that staying active is really about preserving independence, maintaining cognitive function, protecting bone and muscle health, and improving quality of life as they age. Those long-term benefits often become just as meaningful as changes in body weight. At the same time, it is important to recognize the limitations of research. Most evidence linking exercise and cancer prevention comes from observational studies, which can identify associations but cannot always establish direct cause and effect relationships. Individuals who exercise regularly often engage in healthy behaviors, such as eating a balanced diet, avoiding tobacco, limiting alcohol consumption, and obtaining preventative health care. These factors can make it difficult to isolate the independent effect of exercise alone. In addition, genetics, environmental exposures, and other risk factors still contribute significantly to cancer risk, meaning exercise can reduce risk, but it cannot eliminate it entirely. Currently, public health guidelines recommend that adults accumulate at least 150 to 300 minutes of moderate intensity aerobic activity each week, or 75 to 150 minutes of vigorous activity. In addition to at least 2 days of muscle strength exercise, these recommendations not only support cardiovascular and metabolic health, but are also associated with reduced cancer risk and improved outcomes among many cancer survivors. Now, overall, I believe that the evidence strongly supports exercise as one of the most effective lifestyle strategies we have for promoting long-term health. Whether it's reducing the risk of developing breast or colorectal cancer, improving quality of life after diagnosis, or simply helping people maintain strength and independence as they age. Physical activity provides benefits that extend far beyond the gym. While it isn't a guarantee against cancer, it's one of the best investments we can make in our future health. Thank you, and I look forward to everyone else's perspective.